Hi, my name is Chip Lyons, and I'm the president and CEO of the Elizabeth Glaser Pediatric AIDS Foundation. The foundation is a global leader in the fight to eliminate pediatric AIDS. The foundation was started by Elizabeth Glaser to protect her own children and others in the United States. Elizabeth contracted the virus through giving birth and needed a blood transfusion because she hemorrhaged. She gave the virus to her firstborn through her breast milk and to her secondborn, Jake, in utero. When the children's health started to fail, there were no explanations for what was causing that. They were finally all tested for HIV and found to be positive. Elizabeth reacted the way any mother would. She sought to save her children's lives. What she did was Herculean back in that day. HIV didn't affect families, it didn't affect children. What Elizabeth did was to change policy, to change research priorities, to work with the media, work with partners. She went to Washington, she lobbied Congress. She helped to change the narrative in the United States about HIV and AIDS. The result of her efforts with everyone else is that we have virtually eliminated pediatric AIDS in the United States. It's a remarkable achievement. The foundation today is working in 15 countries, the United States, India, and across sub-Saharan Africa. And we bring the same approach in those countries that we did in the United States. We are doctors, we are healthcare professionals, we are public health professionals, researchers that have the tools, the technical capability, the medicines, and everything we need to eliminate pediatric AIDS. We know what to do, we know where to do it. The results of our efforts leads to the elimination of pediatric AIDS. It leads to a generation free of HIV and AIDS. Despite all the progress that we've made over the last number of years, there are still 1,000 new pediatric infections every single day. Every one of those is preventable. We know the science, we have the medicines, we have the tools to virtually eliminate pediatric AIDS. That which we accomplish is because of our donors. We're funded by the United States government, CDC, USAID, by corporations, by foundations, and by generous individual donors. If we keep working together, we see the end of pediatric AIDS and a generation free of HIV for the first time in 30 years. While we continue to work with the international AIDS community to find a cure, to find a vaccine, we can, in the meantime, virtually eliminate pediatric AIDS. We can do that with your help. We can do that through additional research. We can reach more women. We can test more women. We can make sure that more children are born HIV negative with your assistance. Thank you very much.